Breastfeeding is one of the single most important things a mother can do for her child's well-being. Hello, I'm Dr. Katrina Davis, Director of the University Women's Clinic for UAMS, and I want to talk to you about the importance of breastfeeding for not only the baby, but for mom as well. Before a pregnant woman has a baby, she has the big decision to make if she wants to breastfeed or formula feed her infant. Breastfeeding is important for all women, but it is particularly important for African Americans because this group has shown to be less likely to breastfeed than Caucasian women. In fact, we found that in 2010, 74% of Caucasian women reported breastfeeding, while only 45% of African Americans reported breastfeeding. This number is too low, and it contributes to the higher rate of infant mortality within the African American community. If you are pregnant, thinking about having a baby, or wanting to expand your family, it is important to know that there are risks involved with formula feeding, and you should strongly consider breastfeeding your baby. These are a few facts. With over 200 nutrients, mother's breast milk is tailor-made for her baby. There are also other essential ingredients that prevent disease. Some of the nutrients are in formula, but there are over 100 ingredients in breast milk that cannot be duplicated in formula because they are living cells that ensure a baby's healthy development and protect against disease. Fatty acids in breast milk aids the normal development of the baby's brain and vision. Breast milk also has antibodies to protect babies from bacteria and viruses such as diarrhea and ear infections. As a result, babies tend to be sick less often and require fewer medical visits than those fed formula. When a mother breastfeeds, she also helps to protect her baby against sudden infant death syndrome, also known as SIDS, and other diseases such as diabetes, leukemia, and asthma. Also, children who are breastfed for 6 months are less likely to become obese. Breastfeeding mothers are also healthier than those who do not. For example, women who do not breastfeed have higher rates of breast cancer, type 2 diabetes, and ovarian cancer. Women who breastfeed also return to their pre-pregnancy weight faster. And why is this? Well, women who breastfeed burn up to 500 more calories a day than women who do not. Immediately following birth, breastfeeding causes the mom's uterus to contract and help it to return to its normal size. It also reduces bleeding after childbirth. As an OBGYN, I am always asked by new mothers when they should stop breastfeeding. Well, the American Academy of Pediatrics states that babies need 6 months of exclusive breast milk to finish essential growth after birth. That means no water, formula, or other liquids. The Academy of Pediatrics also encourages women to continue breastfeeding through the first year and beyond, with the addition of appropriate foods for the baby. If continuing to breastfeed after 6 months is a challenge, I would suggest that you talk to your doctor to determine the best time to stop breastfeeding based on your lifestyle. Before I close, I would like to leave you with one more benefit of breastfeeding. It is completely free. Families that do not follow breastfeeding practices can spend between $1,200 and $1,500 on infant formula in the first year alone. This does not include the additional expenses of the formula-fed child being sick more often and parents missing work due to a sick baby and medications for the baby. So finally, the decision to breastfeed is a personal one, and no mother should be made to feel guilty if she cannot breastfeed. However, for African Americans, the success rate can be greatly improved through active support from their families, sorority sisters, communities, healthcare leaders, employers, and policymakers. Given the importance of breastfeeding for the health and well-being of mothers and children, it is critical that we all unite to support breastfeeding. To find out more about breastfeeding, you can contact me at adhbabies@arkansas.gov.